Good afternoon, my people. I hope your week has started well, and we thank God for yet another week. And as we continue with our discussion, let's not forget to thank our Lord for the far He has taken us. Today, we are going to discuss about yet another very important topic that you guys and my fans have been requesting that we discuss about it. And before we start our topic, let me start by thanking you guys for the support you are showing me. I always appreciate before I do any video, and I pray God that He may continue blessing you guys. We are almost at 7,000 subscribers, and guys, let's keep the support on. Today we are going to discuss about a very common condition, which is syphilis. What is syphilis? As we discussed before in our previous videos, we talked about urinary tract infection or sexually transmitted infections, and we discussed the whole topic. And from today, we will be discussing about what we call sexually transmitted disease. I want you guys to differentiate between sexually transmitted infections and sexually transmitted diseases. In the part of sexually transmitted diseases, we have only two sexually transmitted diseases. That means they can only be transmitted through sexual intercourse, which are one, syphilis, number two, gonorrhea. So today we are going to discuss about syphilis. So what is syphilis? Syphilis is a bacterial infection that is usually spread by sexual conduct that starts as a painless sore. I hope you get that. It's a bacterial infection that is transmitted or spread sexually and starts with a painless sore. The difference between syphilis and gonorrhea is that in syphilis we have a painless sore. In gonorrhea we have a painful sore. So let's discuss about how is this disease spread. How can it be transmitted from point A to point B, or from one partner to another? One is through what we call unprotected sex, or without using protection, for example condoms, and this might be vaginal sex, anal sex, or oral sex. Number two, it can be transmitted or spread through blood products, for example unclean needles. This mostly affects the healthcare workers. If you use unclean or unsterilized needles, for example, you can transmit this disease from one patient to the other. Number three, it can be transmitted through unscreened blood, for example when doing blood transfusion. That is why it's always very important before transfusion is done, proper screening is always done to prevent any chances of spreading such like diseases which are always in the bloodstream, for example this syphilis and also HIV AIDS. The other point is that it can be spread by mother to baby by pregnancy, or during pregnancy, or labor. Let's discuss about the symptoms, how you can tell that a patient is having syphilis. Note this, syphilis always requires a medical diagnosis. In short, this means for you to confirm whether a patient or a person is having syphilis, you have to do it medically, or take samples to the laboratory and confirm whether this disease is syphilis. For example, VDRL test is specifically for syphilis. So let's come back to the symptoms. One, as I have said before, we have what we call painless sore. A painless sore that can be on the genitals, the rectum, or mouth. This is in the first stage. Number 2, we can have a rash, which is always at the initial sore. So we have the painless sore, and when it comes to the second stage, we have a rash which appears where at the same place where the sore was. Number 3, we have painless ulcers, all sores. Number 4, we have abnormal vaginal discharge. We have a rash or low abdominal pain. The rash may be on the palm and soles. We have itching. We have wart-like growths on the genitals. We have fatigue or feeling of tiredness. We have what we call weight loss. We can also have a mouth ulcer. I hope you get the signs. It doesn't mean any person you see having a mouth ulcer, because we can also have other fungal infection which may develop as an ulcer. It doesn't mean any person or any patient having a mouth ulcer has syphilis. That's why I've just said it needs a medical diagnosis. Let's now come to the cause. Syphilis is caused by a bacteria called Treponema pallidum. Treponema pallidum. Note this, guys. Contrary to what people perceive, you cannot contract syphilis through the following. I want you guys to note this. Contrary to what people perceive or what people believe, you cannot contract this kind of a disease through 1, sharing toilet, like in the case of sexually transmitted infections. So in syphilis, you can't contract this disease through sharing toilet. Number 2, you can't contract this kind of a disease through sharing clothing. Number 3, you can't contract this disease through using another person's utensils or personal items. This marks the end of our discussion, and in the next video we are going to discuss about the risk factors or people who are prone to contracting this kind of a disease. Guys, keep the support on, continue subscribing, liking, sharing our videos so that they may reach as many people as possible. For the returning subscribers, thank you, we appreciate you. Thank you for watching our videos, and those who have not subscribed, please consider doing so. Let's meet in the next video.